Hi everybody, this chapter covers histology, which is the study of tissues, and we're going to start with the epithelial tissues first. Now, just to review, you may recall that tissues are made up of two or more types of cells working together to perform some function. So there are four major tissue categories we will be discussing. This PowerPoint slideshow covers epithelial tissue. I have separate ones covering connective tissues, muscle tissues, and nervous tissue. We also use the abbreviation AT for epithelial tissue, CT for connective, MT for muscle, and NT for nervous tissue. All right, so let's talk about the structure of epithelial tissue first. If you're following me in your course pack, this begins on page 43. Epithelial tissues are classified by having a free surface called an apical surface. The apical surface typically lines an opening, whether it's a tube inside your body, like the digestive tract, or a covering on the outside of your body, like your skin. Epithelial tissues also have a basement membrane, and like the word implies, basement's the lower level that connects the epithelial tissue to an underlying type of tissue, typically an underlying connective tissue. In this image, you can look for the apical surface by looking for the free surface that is not anchored to anything else. You'll notice the apical surface is where the oldest cells are found. They're the top layer of this tissue. The basement membrane is where the new cells are undergoing mitosis, so they'll have a different appearance. And at that point, you have found the bottommost layer of this tissue. Underneath the basement membrane, we will have some other tissue type. Like I mentioned, it's oftentimes connective tissue that's found below the basement membrane. So once again, I want to emphasize that when you're looking at the apical surface, you are looking at the oldest, most mature cells of the tissue, while the basement membrane, that is where we find the lowest level of cells, newest ones undergoing mitosis. In this picture, you have an apical surface near the top. I'm just going to put apical up here. And don't be fooled, the basement membrane is actually way down here, okay? So this basement membrane is at the very bottom of the tissue type. This multiple layers here is actually a set of cells that have been packed tightly because they're most likely dead cells. So this is not the basement membrane here, okay? That's just where the oldest, deadest cells are near this topmost set of layers. These tissues happen to be avascular, meaning what? That means they have no blood vessels. Well, don't let that fool you either, because there are in fact blood vessels in the connective tissue down below, and those blood vessels carry oxygen and other items that help to nourish these epithelial tissues. So blood does reach these areas by diffusion, or the products carried in blood, such as oxygen, reach these areas by diffusion, but there are no direct blood supplies into these epithelial tissues. Think about that for just a moment. If you were to rub up against a brick wall and you had, say, a very good vascular supply of blood to that epithelial tissue, you could bleed severely just by brushing up against a brick wall and damaging that epithelial tissue, forming the outermost layer of your skin. Now, epithelial tissues do have a good nerve supply because we need to sense the world around us. So there are innervations, meaning there are nerves that are supplied to those epithelial tissues. We'll talk later on in the skin chapter about those types of innervations. Sometimes you can feel those sensations in the epithelial tissue, such as in your skin, and sometimes you cannot. It just depends on how these nerves are wired. So epithelial tissue has a variety of functions. It is always a covering and lining type of tissue, no matter where you find it. It does cover the outside of the body. That, of course, is as skin. It also lines any opening to the outside world. So think about this. Your mouth, your nose, your ears, all lined with some form of epithelial tissue. Think about the other end of your body, the urethra that leads out of your urinary system, the anal canal that comes out of the digestive system. For females, the vagina, the uterus, all of these openings that come to the outside world lined with epithelial tissue. So organs of the digestive tract from mouth to anus are all lined with epithelial tissues, as well as endocrine and exocrine glands. So if you had to remember just a couple of words to summarize the functions of epithelial tissue, it would be a covering and lining type of tissue. So let's talk about how you classify epithelial tissues. They are named by the number of layers and the majority of the cell shape. When we look at the number of layers, we typically call a tissue simple if it has one layer. We also look at stratified tissues as having 2 or more layers. Now, having said that, there are other tissues like transitional, pseudostratified, that will help to kind of blur the lines here between these two names, simple and stratified. We also can name an epithelial tissue based on its cell shape. We look closest to the apical surface. I'm going to put that here as a reminder. And those, of course, are the oldest cells and the most mature shape. The majority of the cells typically fall into one of these 3 categories. If they're squamous, they're somewhat flattened. If they're squamous, you may see a nucleus that kind of sits on its side. I make that point because sometimes you don't see the cell shape, but you see a flattened nucleus. Cuboidal cells are exactly as they imply. They are somewhat cube or square shaped, and the nucleus here is somewhat round. Columnar are, again, exactly as their name implies. They are column-shaped, and their nucleus tends to be oblong. Okay, so you may also want to not only associate the shape of the cell, but also the shape of the nucleus, because you may not see this shape of the cell very readily. The way we name epithelial tissue is we put the number of layers first, simple, stratified, sometimes it's pseudostratified, and we follow that up with the particular cell shape, the predominant cell shape, or the majority of the cells fall into the category. Finally, you'll notice that we put ET out here. That's because the general category that this tissue belongs to is called epithelial tissue. So the specific name is this portion here, stratified columnar. The general name is epithelial tissue. So I really want to emphasize this because when you take a lab test, they will ask you to name the general tissue type and then to name the specific tissue type. So you'll want to make sure that you know that epithelial, connective, muscle, and nervous are the 4 general tissue types. Specific names are things like stratified columnar or simple squamous. While we're on this conversation of tissues, I do want to mention that there are cell junctions that hold together some particular tissues and cells in those tissues. These cell junctions may be communication channels. They may be types of fibers that help to bind them together. So let's talk about the 3 on the bottom of page 43. The first one there is called a tight junction, and you'll notice here it does exactly as its name implies. Tight junctions form an impermeable barrier between 2 cells that prevent the passage of fluid. So literally, they make a tight junction between 2 neighboring cells. Think of this as welding. It prevents any fluids from traveling between cells. The layers of your epithelial tissue in your skin do have tight junctions to prevent fluids from making their way through. The next one there is called a gap junction. Gap implies some kind of opening. So these are open channels that exist between neighboring cells, and they allow for ions to travel conveniently between 2 neighboring cells. Later on, we'll learn about muscle tissue and intercalated discs. We find those only in cardiac muscle tissue in the heart. They are, in fact, gap junctions. Finally, we have desmosomes. Previously, we talked about that suffix some to mean body or sac. Desmo means band. So technically, this word means band body. Now, these are like, if I can use an analogy, a 3-legged race. When you have a 3-legged race, 2 people have their legs in a sack together, and if one falls, they both fall down. These cells are held together by bands or fibers that prevent them from being torn apart. So desmosomes help to allow for flexible movement, but not allowing for tearing between these cells. That's not what we want, is these cells to separate. So once again, tight junctions here you can see are welds between cells. What is the function of a tight junction? They help to prevent water passage between cells. They are impermeable to the passage of fluids. Tight junctions, by the way, are the reason we don't swell when we go in a swimming pool. Those fluids in a swimming pool should be hypotonic. Normally, cells will bloat. But you don't get out of a swimming pool weighing 10 pounds more. That's because of these tight junctions. Also, if you happen to be really dry and your skin comes off in layers or sheets, it is those tight junctions partly helping to weld those cells together. Here you can see tight junctions and you can see desmosomes. They look very similar. Let's talk about these gap junctions. They are open channels. Here you can see them connecting two neighboring cells. Let me use an analogy here for you. If you've ever stayed in a hotel room that has a side door to an adjacent hotel room, that's kind of what this gap junction is. It allows for communication or ions to flow directly between cells. So you don't have to go out in the hallway and knock on your neighbor's door. You can open that little side doorway that allows for communication with your neighbor. That is great if you're traveling with friends or family, but freaky scary if you don't know who's staying next door, right? Okay, so that's what gap junctions are, communication channels between neighboring cells. Desmosomes, like I mentioned, are bands, and of course these help to anchor cells together. They prevent cells from tearing apart, and again, they also contribute to helping our skin stay together, and that's why it does peel off in sheets, partly due to these as well. And kind of a cool look here to the desmosome. These are bands or fibers running into that neighboring cell. So you can see these bands here anchoring these cells together. All right, so on page 44, we are now going to cover specific types of epithelial tissues. If you have hard times learning these, I would recommend very highly putting this information on a flashcard. You can print pictures out in black and white or in color. It does not matter. In fact, black and white may be better because then you don't memorize, oh, that tissue's pink or that tissue's blue. Secondly, I would place on my flashcards functions and locations. You're going to be asked this information in both lecture and lab, so you may want to go ahead and flashcard this and use your flashcards for both lecture and lab. We're going to start with this specific type of epithelial tissue called simple squamous epithelium. First off, without even looking at a picture, simple means how many cell layers? That means one cell layer, right? And squamous tells me cell shape. So what is the cell shape here for most of the mature cells? They're somewhat flat with a nucleus that's laying on its side. You're looking at a low-powered section of lung tissue. Now, before we get into these tissues, don't memorize the colors, but you want to look at the cell shapes if you can. This one, of course, has very low magnification and it's difficult to see. Now, also, when you're looking at this particular tissue, you say, wait a minute, I don't see flattened cells at all. Well, like I said, it's a very low magnification. This is a tube. Maybe it's a blood vessel, maybe it's a bronchial tube that passes through the lung, and so is this. But all of these other things here that you see that look like little air sacs are in fact the alveolar air sacs inside the lungs. These are simple squamous epithelial tissue. Being a single layer thick makes it easy for diffusion to occur. If you're looking on your worksheet with me, the function of epithelial tissue, such as simple squamous here, is for filtration, diffusion, exactly what we're seeing here in the lungs, secretion, and this tissue may also help to reduce friction and abrasion. So these are lung air sacs. They are called lung alveoli. Put that word up here for you. Okay, and that's where gas exchange occurs in the lungs. Gas exchange is going to occur most easily over a single layer of cells. Here's another view of those lung air sacs. This structure here that looks like a grape cluster, these are the alveolar air sacs. And what you're looking at here are the bronchial passageways, and each of these are air sacs that have been cut into. A little closer up here, this may be a higher magnification. You are starting to see dark spots in here. Those are the nucleus of the cell. Have a really hard time telling what shape they are. I also have a really hard time in this picture seeing that the cells are flattened. But this is one of those pictures you're going to have to memorize. It looks kind of like soap bubbles, and these, of course, are those alveoli that have been sliced into. This is a little better. Each dark spot here is a nucleus. And of course, this one has been stained pink. You have a very hard time seeing that there is a single layer of flattened cells. So again, this is one you'll just have to memorize. This is a great example of an alveolus. Okay, and of course, when they do a slice here, they have a very difficult time making it very, very thin, but you'll see somewhat a jumble of nuclei in each one of these layers. There's only one true layer here, but it is very difficult to see at this level of magnification. Here's another view of simple squamous, and this reminds me to caution you about just searching the internet in general for anything simple squamous, or any tissue for that matter, because they sometimes give you a different viewpoint. This is a top-down view. It's a bird's eye view of simple squamous tissue. It makes it look like another tissue type. In fact, this looks like cuboidal to me. So just be very cautious when you're searching the internet and looking at pictures. All right, stratified squamous is next. Before we go any further, stratified means multiple layers or many layers. We know that squamous means that they are flattened cells. So I'm looking for cells that have a flattened appearance and a flattened nucleus. All right, so this is a multi-layered cell. This free edge that you're looking at up here is called our apical surface. And why is that surface important? That's where you find the oldest cells. The newest cells are found where? They're found down here near this basement membrane. Below the basement membrane, you shift to a completely different tissue type called a connective tissue. So look at the oldest cells near the apical surface. They are exactly what we would expect to see. They are flattened, the nucleus is flattened, and as you approach down toward these newer cells, you'll notice that they take on a different appearance. In fact, they look maybe columnar, so you're looking at cells that don't necessarily have the mature characteristics of a cell closest to the apical surface. So this particular tissue type may be keratinized, it may be non-keratinized. Non-keratinized stratified squamous epithelium is found inside your body, in places where there may be food passing through in your esophagus, inside your mouth, where feces exit through the anal canal. It's also found in the lining inside your nose, and for females, it lines the vagina. So this particular tissue is in places where there may be abrasion, such as food passing through or feces passing through. And of course, you may need multiple layers here to prevent pathogens like viruses or bacteria from reaching these connective tissues down below. These connective tissues are not avascular. They are in fact vascular, which means they have a blood supply. So this skin or this tissue helps to provide some type of barrier, preventing those bacteria and viruses from reaching that blood supply down below. Here's another great look at a type of stratified squamous epithelial tissue, and it's not a great contrast picture, but it does have really awesome cells. Look at these flat nuclei up here, and you can kind of get a sense that the cells are also somewhat flattened. This top is the apical surface. Basement membrane is somewhere down here. Okay, kind of hard to see on this one. I would estimate it's about right through there. So I don't want to look here, I want to look here because that's where I'm going to find the most mature cell shape. Really awesome picture here of stratified squamous. Again, the topmost layer is called what? That's my apical surface. And why is that important? That's where my oldest cells are. They have the most mature shape. Down below, we've got this basement membrane, and that separates us from an underlying connective tissue. Which of these two tissue types here, epithelial or connective, has blood vessels? Only the connective tissue. Epithelial tissues are avascular. All right, so again, look at these cells up here in the uppermost layers. You'll notice they're flattened. They have a flattened nucleus as well. Don't look down here toward the basement membrane. Those cells are immature, they're undergoing mitosis, and they haven't yet reached their final shape. This is once again non-keratinized epithelium. Can you tell me two places it's located? This could be found inside the mouth, inside the vagina, inside the lining of the esophagus, or lining the anal canal. So the basement membrane here is right through here, and the apical surface is up here. This is the topmost layer. So you'll notice these upper cells have the most true cell shape. Notice those flattened nuclei up here are giving away the clue that we have a squamous tissue type. By contrast, here we have a keratinized stratified squamous epithelial tissue. Keratin is a waterproofing protein that's found only on your skin surface. So in addition to tight junctions, keratin helps to keep you from swelling when you go in a swimming pool. All right, so this keratin is the outermost covering. It's from here to here, and it is produced by these cells in the stratified squamous tissue. So the only place you're going to find this is in the epidermis of the skin. Okay, and of course skin is dry as opposed to the inside of your mouth, which is moist. Okay, there is a very good reason you do not want keratin inside your body. Could you imagine having a bowel movement with a completely dry rectum and anal canal? How difficult that would be, right? Or having a baby with a dry vagina. Ouch. So keratin is only found on the outside of our bodies in the epidermis. All of the other stratified squamous we discuss here is going to be inside the body. All right, so this multi-layer type of tissue's function is to protect us from abrasion, pathogens, or chemicals. All right, so where's the apical surface in this image? All right, that's your apical surface. All these cells here are part of the epithelial tissue, and so are these. So down below here, this groovy edge is actually the bottom portion of your epithelial tissue, and of course that's your basement membrane. This is also a good time for us to review. What is the general name of this tissue? It's epithelial tissue, and its specific name is stratified squamous. We've seen this picture already. The apical surface is up here at the top. The basement membrane is here down below. Okay, so all of this is the stratified squamous tissue. So this may look really, really thick, but this might be, say, skin on your heel, and it's really no thicker than a piece of paper towel. So that kind of gives you an idea of how thick some of these stratified squamous tissues actually are. Let's talk about simple cuboidal next. Again, simple means how many layers? One layer. And the shape is somewhat square cells with a somewhat round nucleus. In this picture, you're looking at simple cuboidal epithelium, and so I want you to think about where the apical surface is located. Apical surface is down here. Okay, so be very cautious on lab tests that you pay attention to where the apical surface is. It may not always be oriented up, left, or right. It may in fact be a slide upside down. Down here somewhere is where the basement membrane is going to be held. Okay, so these are square-shaped cells. They have a mostly round nucleus, and if you look really closely, they have a very tiny fuzzy surface, and those are cilia on the outside of those cells. Okay, so that is cilia right through there. These cells are found in places where we're moving something along, and they're not always ciliated. Sometimes they are, but this particular picture happens to be. You'll notice the locations listed in your worksheet. They are found on the ovary surface, lining of our kidney tubules, and the ducts and glands, or ducts and secretory portions of our glands. This picture here shows us the ducts of our kidney tubules, and these kidney tubules are basically tubes. Right there, what I circled first is the basement membrane, and in here is the apical surface. And fluids actually travel through this surface here. That's an opening called a lumen inside that duct. There are lots of tubes that you can see here. There's just a whole picture full of them. All of them have the apical surface on the inside and the basement membrane out here around that outside surface. Now, notice the nucleus shape. This is a great shaped cell, mostly square, pretty round shaped nucleus there. Same thing here. Okay, so the cell shape is pretty spot on in terms of looking for a square shaped cell and a very round nucleus. Notice the function of this particular tissue type. It's often involved in secretion and absorption. Secretion means that we're releasing substances into the inside of our body, perhaps into tubes. And absorption means that we are moving things into our bloodstream. This is a fantastic picture of kidney tubules. And once again, I'm going to circle one of these tubes or ducts. There you can see the basement membrane, and in here, that's the lumen or opening where the apical surface is housed. Again, you're looking for that apical surface to confirm for you that you have a type of epithelial tissue. These, again, have really fantastic round nuclei. That is a super clue in confirming that this one is simple cuboidal epithelial tissue. All right, it's a great time to review. What is the general tissue type of this picture? Epithelial tissue. And the specific name is simple cuboidal. Okay, so again, you're looking at kidney tubules, you're looking at lots and lots of them in there. Here's a sweat gland. It looks almost identical to that previous picture of the kidney tubules. And again, you're looking at very nice round-shaped nuclei in those cells. It may not be perfect because they cannot cut extremely thin enough pictures or slides to get a great picture. These are also more sweat glands. Let me circle a few for you. There's a couple here, one there. Looks like a pretty large one there. So again, you're looking at a majority of the cells falling into a category, such as somewhat round-shaped nuclei and somewhat square-shaped cells. Let's talk about simple columnar. It has one layer. We know that because simple implies one layer. And this time we know the cell shapes are brick-shaped or column-shaped with a nucleus that stands oblong. One place we find simple columnar epithelium is in the lining of the digestive tract, from the stomach to the rectum. That means stomach, small intestine, large intestine, all the way to the rectum. The gallbladder has this particular tissue, as do some of the tubes of the kidneys again, and uterine tubes, which are basically fallopian tubes in a female. Uterine tubes connect a female's ovaries to their uterus. So what we've got are long skinny cells with oblong nuclei. You can imagine right here would be one, and that's a really nice oblong shaped cell. We oftentimes will see other cells embedded in this tissue. Remember that tissues may have two or more tissue types working together. The alternate tissue alternate cell you may find here rather is a goblet cell. Goblet cells release something called mucus. So this particular set of tissues has a bunch of goblet cells. They're all scattered throughout here. Okay, and you may think, well, why in the world do we need mucus in our digestive tract? It has to do with lubricating the passage of food or protecting the lining. So it depends on which organ we're talking about. Another look at simple columnar epithelium. Notice these really nice column-shaped cells and these oblong nuclei. This here is the apical surface. Where's the basement membrane? Right through there is your basement membrane. Okay, this stuff all along here, what is that? That's cilia. So this must be in a location where we're moving something along. Another great look at some nice columnar cells. Okay, long skinny cells. Nice looking nucleus there. Here is your basement membrane, and here is your apical surface. Here is something like perhaps the digestive tract. This would be where food passes through in this direction here. This is your apical surface for each of these, and your basement membrane for each of these. Underneath, we have a completely different tissue type. Okay, so we do have a single layer. Each one of these is simple columnar epithelial tissue. Another view of these goblet cells right here, okay, These are great looking goblet cells, and these are really long skinny cells, nice looking nuclei there. All right, what layer have I just drawn here? That's our basement membrane, and this free surface here is our apical surface. So how do you know that this is an epithelial tissue? What do you look for? Well, look for a free surface called an apical surface and an underlying layer called a basement membrane. That's where we transition to a different tissue type. What you're looking at here is a slice of the small intestine. Right through here is your basement membrane. That's the very bottommost portion of your tissue. Each one of these little finger-like extensions here is going to be a villus, plural, we call them villi. They, of course, have the apical surface. If we were to pull this up and look at it more closely, it would look exactly like some of those previous pictures, where you could see the simple columnar cells and you could see those really nice oblong nuclei. So this increases the surface area of our small intestine and allows for us to maximize absorption. And if you notice in your worksheet, one of the main jobs of simple columnar is secretion and absorption. All right, so our next one is pseudostratified columnar epithelial tissue. Let's break this down. Pseudo means false. Stratified means many layers. Columnar means that we have long skinny cells with an oblong nucleus. Now, here's the catch. Pseudo-stratified means it's a falsely layered tissue. In fact, it doesn't have multiple layers. In reality, it's a single layer of cells. So, why don't we call it simple columnar? Well, we've already got one of those, right? This one actually looks stratified when we look at a picture in just a moment. But in reality, every single cell touches the basement membrane. So it's truly a simple tissue, meaning it's got one cell layer. But in reality, what you see when you see a picture of this is a false appearance of multiple layers. All right, so here you can see pretty low magnification, very pretty picture. This is our apical surface up here at the top. It is ciliated. All of these little things sticking off the top here are cilia. And basement membrane happens to run right through here at the bottom. So again, you can identify this one as an epithelial tissue because it has an apical surface and a basement membrane. Great picture here of pseudostratified ciliated columnar epithelial tissue. Boy, that's a mouthful, right? Sometimes we call that one PSCC. P for pseudo, S for stratified, C for ciliated, C for columnar. So pseudostratified ciliated columnar epithelial tissue. Boy, that's like a lot of names there. Where's your apical surface? Up here. These are the cilia, right? Basement membrane's pretty clear here. Okay? And every single one of these cells that you see actually touches that basement membrane. I know it's hard to believe, right? But every one of them actually has a connection down to that basement membrane. Nice columnar shaped cell, nice oblong nucleus in each one of these. Once you've seen one of these, it's hard not to be able to recognize it. There are not true layers here, okay? So each one of those cells looks jumbled, does in fact touch that basement membrane. All right, so this particular type of tissue protects, it secretes, and it propels mucus. If you look at where the locations are, lining of the nasal cavity, trachea, bronchi, portions of the male reproductive tract, the majority of these locations here are respiratory in nature. So we protect the respiratory system with these cilia. They help to move contaminated mucus along so that we don't get it further down into our respiratory system. In the male reproductive tract, this particular tissue helps to move along sperm. So I know there's a lot of information coming at you so far. This can be overwhelming. Think about the simple columnar tissues. They were mostly in the digestive tract. Think about this one. It's mostly in the respiratory tract. When you're learning examples, think about that. That helps you to generalize which system these tissues typically belong to. Another great picture of pseudostratified ciliated columnar. See, they've used that abbreviation right there. There's cilia up here. That's your apical surface. And down below here, that's your basement membrane. So what is the general type of this tissue? It's epithelial tissue, and its specific name, pseudostratified, columnar, ciliated, and of course, epithelial tissue is its general category. All right, so this one is odd, unusual, easy to spot because of its jumbled cells. In fact, it is truly only a single cell layer. Okay, just another view of pseudostratified. In this picture, where is your apical surface? And your basement membrane? Over here on the left. This picture says, notice the cilia. Where is the cilia? It's this stuff. It looks like shag carpet or fuzz on top of those cells. What is the purpose of the cilia? It helps to move along a current. It sweeps something along, whether it's mucus or sperm. Where's two locations you'll find this tissue? Lining of your nasal cavity and your trachea. Where's the basement membrane in this picture? Down below, notice the transition to a different tissue type. All right, so transitional epithelial tissue is our last one on this page. We're still on page 44 in your course pack. You'll notice that we didn't talk about this one being simple or stratified. It truly is stratified. It's made up of multiple layers. And in this picture, it's upside down. Where is your apical surface? Right there. You'll notice they've already labeled the basement membrane for us. It travels around here. The underlying tissue type, in fact, is connective tissue. I want you to look at the apical surface for just a moment. Those cells don't look flat like squamous cells, do they? They are somewhat teardrop shaped, especially these here and these here. Notice their nucleus is what shape? The nucleus is round, okay? So I want you to think about that when you're learning these tissues. This is a great way to distinguish transitional epithelial tissue from, say, stratified squamous epithelial tissue. You also don't see layers and layers here. All of these cells seem to be pointing at this basement membrane. Okay, look all along here. They're all pointing at that basement membrane. Now this tissue is great for distension or stretching. Okay, and it's found in the urinary system. So like I said, simple columnar, common in the digestive system. Pseudostratified columnar is common in the respiratory system. And this tissue, transitional, is common in the urinary system. It lines the ureters, which connect your kidneys to your bladder. It's also found in the urinary bladder because, hey, it has to stretch to hold urine until you release it. It's also found in the renal pelvis of the kidneys. That again is a holding tank for urine before it travels down the ureters and into the kidneys, or rather into that bladder. So this is a very unusual type. It does stretch and return to its original shape. So this one is unusual. Look for those teardrop shaped cells. Here, where's your apical surface? It's on the bottom of this picture. Looks like right through here is your basement membrane. And again, some of these cells might fool you and look somewhat flat, but check out that round nucleus. Same here. That may fool you and look flat. Again, another round nucleus. Look at these teardrop-shaped cells. They are pointing at that basement membrane. Okay, see, they all point at that basement membrane. All right, where's the apical surface here? It's this free surface up top, and the basement membrane is down below. So where are two locations you're going to find transitional epithelial tissue? Lining the ureters and the urinary bladder. So just for comparison, which one of these is stratified squamous epithelium and which one is transitional epithelium? The one on the right is stratified squamous. And I know that because I see flattened layers, I see a fairly flat nucleus, and I definitely see flattened cells toward the apical surface. That's where I'm going to look to get the truest cell shape. The picture on the top left here is transitional. And I'm looking at somewhat tear-shaped cells. They all do point at that basement membrane, which happens to flow right through there. And even the topmost cells are not flat in appearance. The nuclei are somewhat round on these transitional tissues, and of course, these are found only in the urinary system. All right, another one for comparison, which one of these is transitional and which one is pseudostratified, columnar, ciliated epithelial tissue? Well, again, this one here is transitional. Now I'm looking at tear-shaped cells. I don't see oblong nuclei. Instead, I see round nuclei. Okay. By comparison, pseudostratified ciliated columnar. That's right. I look for oblong cells here. Okay. And all of them touch that basement membrane. Also, check out those cilia. All right, these next two I'm just showing you for fun. I just want to show you these so that you know that there are other tissues that we're not learning and to help you distinguish them from ones that we are learning. The next two slides are stratified columnar and stratified cuboidal. There's only 2 layers in each of these. They're very simply stratified by having only 2 cell layers. So let's take a look. Stratified columnar on the left has a layer of cuboidal cells here on the bottom and a layer of columnar cells on the top, whereas stratified cuboidal is just stacks of layers of cube-shaped cells. So this one, you can actually see a set of columnar cells here and a set of cuboidal cells down below. So this is what stratified columnar looks like.